Oh, it gives me really a great pleasure to introduce our next awardee, Dr. Marion Dove, who really has done it all and continues to do it all. Director of the Residency Program, Associate Chair, Department of Family Medicine, current Chair, Department of Family Medicine, Associate Professor, Director of Faculty Development for the Department of Family Medicine. Just the list goes on and on, the implication, the drive and the implication in education. Has, in terms of recent awards, Program Director Leadership Award in 2018, Award for Excellence of Contribution to Teaching in Family Medicine, awarded by the Quebec chapter of the College of Family Physicians of Canada. And I think in a large part that was based on work that she did with the College of Family Physicians of Canada, developing the Fundamental Teacher, the FTA, the Fundamental Teaching Acts. Thank you very much, which define the teaching competencies in family medicine. And while we say in family medicine, these have been used and adapted and adopted nationally, internationally, really an incredible amount of work and relevance to the training of physicians across the spectrum. Comments from her colleagues: her teaching contributions are extremely varied, spanning the entire range of levels, sites, venues, types of medical education, level of learners, including from medical student to her colleagues. Her evaluations from all of these have been very strong, always attesting to her abilities to teach learners at different levels in these contexts and with different modalities. Over the years, Dr. Dove has shown both educational leadership and innovation, and she has pursued both with competence, enthusiasm, and humor. Dr. Dove has made enormous contribution to the educational mission of our faculty, and I would say to our profession. Given her accomplishments and her outstanding dedication to teaching, I cannot think of a more worthy recipient of this award and recommend her with enthusiasm. From her students, impressive physician, teacher, and role model. Very kind, supportive, always there to help and answer questions, very calm with patience. And this one in particular I love. She reminded me why I chose this profession. So with that, Dr. Dove, I invite you down.
So I go on this thing? Okay. Technology is not my forte. So I'm really pleased to be here today, and I'm really honored to receive this award. Today I wanted to talk to you about family medicine, which is my passion and my inspiration. So I wasn't sure how official I was supposed to be. Wait, wrong way. There we go. So I just wanted to say I have no financial conflict of interest, although I do always promote breastfeeding wherever I go. Since you're a captive audience, though, I thought I'd propagandize you a little bit, because I wanted to talk to you about how wonderful family medicine is and talk about a little bit of a call to action to improve our healthcare system. So as I was reflecting about what I wanted to say today, I sort of returned to my roots. So I'm a little bit embarrassed to say this in Montreal, but I grew up in the other city. And as I was growing up in Toronto in the 1980s, I had a very multicultural and cosmopolitan group of friends, and I became quite convinced that a single-payer healthcare system was the way that healthcare should be organized. But I had an American mother who called me a communist and a British father. So I stuck with my principles nonetheless. And then I went to this university that we often call the McGill of the South. And I studied physics because I thought that that made a lot of sense. And then I saw firsthand what private healthcare is like. So that really consolidated my view that a public healthcare system is the way to go, and it's the pillar of a just and equitable society. Then, because I hadn't done the MCATs or studied a lot of biology, I went to the one medical school that didn't require those for admission. So I went to McMaster University, which when I went for my interview, I thought it was a factory, but that's actually a medical school. Then I came to McGill for my residency. This is not Blockbuster Video. This is actually a clinic. This is at the corner of Côte des Neiges and Côte Sainte-Catherine. This is the CLSC Côte des Neiges. I actually ended up there thanks to my ex-husband because when I came for my interview in family medicine, they showed us all these amazing teaching sites, and I couldn't decide where I wanted to go for residency. So I took the avoidant option of not submitting my form. So on the day of the match, they were trying to find me, and they called my house. And my ex-husband answered because I was off doing an elective. And he said, oh, she wants the CLSC Côte des Neiges. So that's how I ended up at the CLSC Côte des Neiges. And that was a great thing for which I still thank my ex-husband. I did a little detour in Toronto for a year after my residency to do a scholarship in women's health, which really taught me that one of the biggest issues for women's health around the world is violence against women. And this has really colored my practice. So I came back to Montreal right after that, and I've been at the CLSC Côte des Neiges ever since then, working as a family physician. I do deliveries at the Jewish General Hospital. I think some people think family doctors just treat like a lot of colds, but we actually do a lot of different things. And so I'm going to talk a little bit about some of the different things that we do. This is a very happy patient after she delivered. This is the call room where I spent a lot of time, and this crappy obstetrical tracing that I watched for hours. And that's the kind of meal that we used to eat when we were on call. That one I really liked because of the peanut butter cups and the Doritos. During this time, I also started a family, and this is the cuteness that I had back in 2001. And I want to thank all of my colleagues and my family for helping me along the way. So when I became a faculty member in the late 1990s, I left a lot on maternity leave, and my colleagues always covered me. This is what happened by 2022. So I spent a lot of time in the last 20 years driving to hockey arenas, to swim meets, and to soccer pitches. And I couldn't find a great soccer picture of you that was recent. So this is the engineering picture. My daughter's now running the Champlain Bridge, just saying. So the other thing that I did where my colleagues covered me like a big family was I went to a small community called Blanc-Sablon for a couple of years to work. So this is Blanc-Sablon in the middle of summer. And this is a community that is so far away that it is 1,500 kilometers away, and it's still within Quebec. So it's really on the very tip of Quebec, right at the border of Labrador. And they had these baseball caps there that said, Labrador, it's not the end of the world, but you can see it from there. There's no way to get to Blanc-Sablon by road. The road ends, well, it used to end in Natashquan. I think it might have been extended a bit. You can get there by road if you drive through Labrador about 500 kilometers on a gravel road, or through Newfoundland and take a ferry across. So needless to say, work there was quite challenging. I was responsible for one of the little villages on the coast. We flew there 1 week a month, and this village called St. Augustine had also an Indian reservation or a native reserve across the river. So I was responsible for both those villages. And when you were in Blanc-Sablon, you could get a call from the village any time. So of course, one time when I was on call, there was a call that a woman was having a heart attack in the little village. So what do you do when a woman's having a heart attack in the village? Well, you had to transport her to Blanc-Sablon, to the little hospital. Now, most research focusing on heart attacks doesn't deal with these different modes of transport that you have to use. So she was put into a pickup truck and then into a boat to get across the river to the little airport in Pakwashipi. She took a minivan from the boat to the airport in Pakwashipi, the airplane to Blanc-Sablon, and the ambulance. But the time that it took us to get her the thrombolytic agent was less than 3 hours, which a cardiologist in Montreal told me was a very good time, door to needle, and as we all know, time is myocardium. So the thing in Blanc-Sablon is that the airport isn't very big, and sometimes you feel a bit isolated there. But I have to tell you that the airport in Blanc-Sablon is big enough to let the Challenger airplane land, and this is the air hospital that flies around Quebec and picks up people who are ill, and this is the patient that we were then, with the heart attack, that we were then transferring to Quebec City. And I just want to say this is why we pay our taxes, because the government pays for this beautiful hospital that is in an airplane and a doctor to fly around and pick people up in the middle of nowhere who are having a heart attack. So I just wanted to reassure you that family doctors are on this. We've got it covered. So coming back to Montreal after Blanc-Sablon, I continued with some of my educational leadership tasks. So I was the undergraduate teaching director at my clinic, the CLSC Côte-des-Neiges, from 1998 to 2009, but with multiple interruptions, as you will remember from the 3 children and the 2 years up north. Then I became director of faculty development in the department, and that was super fun, teaching all my colleagues, and I got to go around to all the different teaching sites that are affiliated with the Department of Family Medicine, including Val d'Or, Gatineau, and Châteauguay. Subsequently, the director of the residency program really wanted me to take his job. He was dying to move on, and I ran into him one day on Côte-des-Neiges, and he said, "Marion, when are you going to apply for my job?" And I said, "But Doug, surely they want somebody who knows what they're doing." And he said to me, "They haven't noticed yet." So I decided to apply. Then, as I was minding my own business and being very happy as director of the Family Medicine Residency Program, the previous chair of the department, for those of you who know Dr. Howard Bergman, know that he can be quite persistent. So I would say approximately once a day, he would come and talk to me and say, "Marion, you're going to apply to be chair when I retire, aren't you?" And so I hemmed and hawed, and on the last day when you were allowed to apply, I called Leslie Fellows, and I said, "Leslie, I don't really know whether I should apply to be chair or not. I can't decide." She's like, "Well, why don't you apply and see what happens?" So anyway, here we are. So just saying, don't ever apply for a job that you don't want. I'm just kidding. So as chair, I get to work with the wonderful family that is the Department of Family Medicine, and I have to say, we really are the best department. I'm sorry for those of you in other departments, but we really are the best department. Many of my colleagues are here today supporting me. I want to thank you all for being here, including some of the support staff. Rosa Coppola is here, who remembers me from, I don't know, when I was a resident probably. Kennedy had to go to Kenya for a family member's funeral, but 2 of my children are here too. My son is in Germany playing hockey. I just wanted to wrap up by giving you the 3 messages that I spoke to family medicine residents about last week as they were presenting their research projects. And this kind of sums up the things that I have been talking about in this little quick overview of my career as a family doctor. Family medicine is really the pillar of any successful healthcare system. Be the change you seek. Create the family medicine we all want by 2030. We're all empowered to do that. We're all in positions of privilege. We can create the healthcare system we want. And adopt anti-racism. We have an obligation to assume, to recognize the contributions of medicine to racism in our society, and we all need to be very active in countering that. So these are, again, my 3 children, and my youngest just turned 21. They keep me humble. I don't know if you know that I am the stupidest person on the planet, that I not only stand wrong, but I also breathe wrong. So with that, I'm glad you've never noticed, David. So they are wonderful. They keep me humble, and I'm so happy to see all my family and friends here today, and thank you all very much for listening.